We're going to broaden out the conversation now, and as the panelists take their seats, take a look at how two of them sparred the last time Congress debated health care.
We want universal coverage by a date certain. We want to ensure that whatever mechanism brings that about is very clear and is as immediate as we can make it.
If better means more government, more bureaucracy, more mandates, more price controls, or more taxes, then we don't want to make it better.
Bob Dole and Tom Daschle in 1994. They are joining us now. Let me welcome the former Senate Republican leader Robert Dole, former Senate Democratic leader Tom Daschle, Congresswoman Maxine from the Democrats, Congressman Mike Pence from the Republicans. And Senator Dole, let me begin with you because Robert Gibbs gave us a lot to chew on there. On the one hand, he says that the president is ready to introduce legislation as you call for, except you also heard him there. He says the president is going to come up Wednesday night and argue for that public option. Is that helpful?
Well, I mean, he has every right to do it, but I don't think it's going to go anywhere. And, you know, in our recommendations, as Tom can verify, we permit a public option after 5 years, and the insurance companies haven't cleaned up their act. Then there's a trigger of sorts, and you can get into a public option. But I think we've spent too much time on that. This is a massive piece of legislation, 1,200 pages, and there's more to it than just a public option. You know, I think we ought to go back and look at cost containment, look at insurance reform, look how we can encourage people to be more responsible themselves. And there are a lot of things we can do that will not cost as much money, because I know Congresswoman Waters is very conservative when it comes to spending, and we want to help her if we can.
So is this going to provide the kind of fresh start you were calling for earlier this week?
Well, I don't want to say that because I was calling for it. I think it will, though. I think once the president is in charge and has ownership, it's elevated. I mean, I think he'll jump up in the polls because the people, Democrats, Republicans, wherever they're from, have confidence in the President of the United States. It's a little wobbly these days, but generally, whether it's a Democrat or Republican in the White House, when he takes on an issue, claims ownership, and said, this is what I want to do, not what some committee wants to do or some very powerful member wants to do, I think it's a big, big plus for the president.
Let me bring your Democratic counterpart in here. You know how to count the votes in the Senate. And the president clearly now going to make this argument for the public option. But at least from my reading, it doesn't appear that that's going to move the Democrats in the Senate who have to be moved. There's been some pretty stiff opposition.
Well, George, I think what you have to do, we haven't had the first vote on the floor of either the House or the Senate. You know, we're already deciding what's in, what's out, what's good, what's not, before we've had the first day of debate. And I think what we ought to do is have a good debate. The president's made it very clear where he stands. Now it's the Congress's opportunity to respond. If they don't want it, then we have to make an assessment at the end of the day whether all the other things we've done, just as Bob said so well, is worth support. You know, we have an opportunity to expand coverage to every American, to control costs for the first time in a real way, to dramatically improve quality, which we need so badly, and to provide more Americans with greater choice.
Here's my question for you. I mean, both you and Senator Dole called for this bipartisan approach that didn't include the public health insurance option. Do you think as a fallback after 5 years, as a matter of strategy, is it better for the president to push for this at the front end, knowing that it's going to upset a lot of Republicans and hurt the chances for a bipartisan deal, or is it better to have a kind of preemptive concession saying, you know, we've had some debates about this, we're not ready to go?
Well, my advice to the president would be what others have suggested as well. Make yourself very clear. Make it clear what it is you want, and then let's have the debate. You know, at the end of the day, you've got to make concessions. You've got to negotiate. There's always give and take. But to give and take before you even get the debate underway seems a little premature to me.
And Congresswoman Waters, you've been a strong advocate of this public health insurance option. You've said, as part of the Progressive Caucus, has said that they will not vote for any bill that doesn't include a robust option, either first time through the House or when it comes back from the Senate in conference. From what you heard from Robert Gibbs today, the way he described the public health insurance option and the way he called it valuable and not essential, is that going to get the support of you and other progressives?
Well, first of all, We support what the president has said all along he'd like to see, and that is a robust public option. He campaigned on it. He continues to talk about his support for it, and we're going to stand behind him. Nancy Pelosi has said that nothing's going to pass that floor without a public option. With all due respect to Senator Dole, the Republicans are not going to support a credible health care reform bill led by the president or the Democrats. We're not going to get their support. I appreciate the work that's been done by the president to try and get a bipartisan bill, but there will be no bipartisan bill. And I would like Senator Dole and former senators both to talk about what it means to use budget reconciliation with a majority of the senators getting this bill passed rather than trying to continue to cajole the Republicans to support.
I want to get to that question next,
yes.
But first let me bring in Congressman Pence, because you said no matter what, Republicans just aren't going to support anything the president calls for. Your response?
Not true, George. And Maxine knows how much I like and respect her. But Republicans are ready to work for comprehensive health care reform. You know, when I went home and did town hall meetings across the state of Indiana, you know, I heard people saying, look, we need health care reform. We need to do something to lower the cost of health insurance for families and small businesses and lower the cost of health care. But I also heard people say that they don't want a government-run plan that's going to lead to a government takeover of health care in this country.
But where's the government
with $800 billion in higher taxes?
If a public health insurance option is simply one choice among many, as Robert Gibbs has said, how is that a government-run plan?
It's a really fair question. And I just saw Robert Gibbs on the show say that a public option introduced would not affect people in any way, shape, or form. Look, the American people know better. I mean, when I get up in front of folks and I say, look, in this economy, an economy that just swelled to 9.7% unemployment. We lost 1,000 Whirlpool jobs in Evansville, Indiana 2 weeks ago when I was there. In this economy, there's no small business or large business worth its salt that isn't going to take a hard look at sending all of their employees to the federal government for their health insurance the minute a public option is available. Under the plan that's been proposed, businesses have to pay what, an 8% payroll tax, and they can cancel all of their coverage. I mean, the president says you can keep your health insurance if you like it, but it's awful hard to keep your health insurance if your employer cancels it.
What's the answer to that objection?
Well, what we have said from the very beginning is that we're going to level the playing field. There's not going to be an inherent advantage, George, with the government plan. So Congressman Pence's prediction, I think, is really baseless. If you have a real competition, he has supported, and rightfully so, the FEHB model, the Federal Employee Health Benefits Plan model. That's what we have in Congress. We have a myriad of choices, a myriad of options. You don't see anybody rushing to one over the other because there's equal competition. And that's exactly what we would have in these exchanges as the president has proposed.